My name is Johnny Chen. I'm the professor in the Michael E. DeBakey Department of Surgery at Baylor College of Medicine in Houston, Texas, USA. I've been working there for 15 years, working on the cardiovascular risk factor, focus on the molecular pathway and then the animal models. So I just present our recent studies in one of the very significant clinical risk factor called the uric acid. The patient, there are a lot of patients, like 20% of populations has such a high level of uric acid in the blood, so-called hyperuricemia. So clinical studies indicated if high uric acid in the blood tend to cause vascular disease called the independent risk factor. So specifically, I present our data and then very excited, get a lot of response questions we discussed this morning. And then specifically, we treat human endothelial cells with uric acid at the clinical level and then cause endothelial cell dysfunction. More importantly, we use animal model. First of all, we establish animal model. We're knocking down one gene called the uricase that leading to the uric acid high levels in the blood. If this animal not treated, they have caused the cardiovascular disease. So we use this model to look at the endothelial cell dysfunction, specifically ENOS. It's called endothelial cell nitric oxide synthase. This is the key genes play a normal function. If uric acid is high, they tend to reduce this gene, which is increase the cardiovascular disease. Even more importantly, we try to develop the new drugs, hopefully can use in the human, and then can reduce the uric acid, reduce the cardiovascular event. In this specific animal model, we show if you use these drugs, we can reduce the uric acid induced endothelial cell dysfunction. Animal is happier. So hopefully, we can introduce this drug in the clinical through the aggressive clinical trials. That way, we can, the patient can use that medications to prevent cardiovascular disease. This approach is particularly important because clinically there are no long-term chronic use drugs for prevent so-called asymptomatic hyperuricemia. For example, allopurinol being used for 40 years, but only used for the gouts with the hyperuricemia. If a patient has no gouts but has the high uric acid in the blood, there are no drugs can be used because the side effect for long-term use. So hopefully, we can continue to do our study, collaboration with this forum. We're very excited for this meeting in here. I've been here almost every year for the last 10 years. I feel that's the International Academy of Cardiology annual scientific meeting is very, very helpful. Hopefully, we can establish more collaboration with scientists presented in here, and then further our collaboration for clinical use.